Hello, I'm Dr. Jeffrey Klein. I'm a dermatologist and clinical pharmacologist, and my specialty interest is in treating the most severe forms of cutaneous and musculoskeletal pain. So I'm going to tell you about Bob and his treatment for his severely painful proximal humerus bone fracture. We treated him with Tumescent, epinephrine, lidocaine, and some cefazolin and triamcinolone. And that delivery was done with a handheld Tumescent transfer tubing that is made by HK Surgical. This tubing allows one to not need a pump. You just use the handheld device, and it can put in 100 milliliters up to 250 milliliters very easily. Very portable. Anyway, so Bob got this local anesthesia, and his pain previously was 6 to 8 over 10 throughout the day, and subsequently, without any further treatments, it's been around 1 to 3 over 10, and which has changed his life significantly. He can now do his range of motion exercises without severe pain, and he can sleep well.
So fractured head of the humerus. Once you see a 32 gauge needle, 4 millimeter long, you give a little injection here. This only hurts if you have a guilty conscience.
Doesn't hurt at all.
I know. So it's just 1 milliliter of this for local anesthesia before I put a slightly larger needle to his skin. How bad was that?
That was pretty easy.
Did you feel anything?
I mean, I felt the needle, that's all.
How bad was that?
On a scale of 1 to 10, it was a 1.
A 1, okay.
This is my patient, Bob, and he has had a fall about how many days ago, 10?
4 weeks.
4 weeks ago, wow. And you're still in pain after fracturing your right or your left humerus, the left shoulder was fractured. And lately, how much pain have you been in on a daily basis on average?
6, 7, 8.
Okay. And how much pain did you experience when I gave you an injection just a little while ago?
Really nothing at all.
Nothing at all?
0.
Okay. And we injected about 120 cc's of dilute lidocaine with epinephrine, containing some antibiotic and some triamcinolone. And that has relieved some of the pain. How much pain are you in right now?
None.
None. So there's very few treatments to relieve pain for a fractured humerus, and certainly not much that can do that with no pain at all and essentially no side effects. There's no narcotics involved, and it's very dilute, relatively large volume of local anesthesia. So we're going to have him take a pain diary home with him and record the pain on an hourly or every 2 to 3 hour basis. And I'll see him back tomorrow, see how he's doing. Thank you, Bob.
Thank you.
So you met Bob, who had a fractured humerus, and I treated him, and it resulted in extremely satisfying results. No pain after that treatment. It was durable, and he required no further treatments. And this is the technique that I use. So I'll show you the devices, and it's very simple. So this is a bag of saline. It's 250 milliliters, and in that I put 250 milligrams of lidocaine and with some epinephrine, and it has some. I'll also add bicarbonate and some cefazolin and triamcinolone. And I mix that in this bag. I call this a reservoir bag. I don't call it an IV bag because it's not supposed to go IV. It's supposed to be only in subcutaneous tissue. This is a 10 cc syringe, a 25 gauge needle, 1 inch long. And this is the HK Surgical Tumescent delivery syringe tubing. It's a tubing that we designed specifically for this technique. So, this is the tubing. It's simple in concept. This is a two-way check valve. It has a spike that goes into the IV bag. So I'll show you that.
Spike goes into the IV bag, thus. Okay. So now we've attached the tubing, the transfer tubing, to the reservoir bag. We call this a reservoir bag now, because it's a reservoir for the tumescent drug delivery system. The fluid comes from the reservoir bag, goes to a two-way check valve, and this two-way check valve has a connector for a 10 cc syringe. There. And then when we pull the fluid, pull this back, the fluid goes from the reservoir bag into the check valve, goes right into the syringe, and when I push the syringe plunger back, it only can go out this direction and ends up here in the outlet port. And that's where we attach the hypodermic needle. So there we go, we're all set up. Now, we need to prime the tubing. That means get fluid from the reservoir bag into here. So we pull this back, it's sucking fluid in there, and now we fill the syringe. Now I'll squirt a little bit out. Now we're ready to go. There's fluid from the reservoir bag, the tubing is filled, and this is filled. So now this is just inserted into the patient's subcutaneous tissue. It never goes deeper than subcutaneous. Actually, it's very superficial. We can treat fractured bones, rib fractures, humerus fractures, clavicle fractures, and with extremely good results, dramatic reduction in pain, but it's only subcutaneous because we're using the Tumescent technique. That means that we're using a large volume of this very dilute local anesthetic solution, which creates high subcutaneous interstitial pressure and pushes the fluids and the drugs through the tissues where we want it to go without having to go deeply. So in Robert's case, for his arm, for his shoulder, you only used 100 milliliters of solution, and that was sufficient to give him complete relief. So here's we go. So you can see that I'm squirting this out. And I fill the syringe again and continue. So it's a very sophisticated and simple technique for delivering a large volume of fluid into subcutaneous tissue. Before the Tumescent technique was invented, I should say before I invented the Tumescent technique, you had to use syringes, separate syringes, and it was very, very tedious. This is a very efficient and convenient way to do it. And I use this for all of my larger excisions. So when I'm excising melanomas or large skin cancers or doing something like hidradenitis suppurativa, large excisions, I use this. It's super convenient and easy.